to the Aligned Modern Health Digital Doc Conversation on Natural Hormone Balancing. Thank you so much for joining us today. We are joined by Dr. Helena Parra and Dr. Sarah McGee for this very important conversation. Before we get started, we'd like to introduce Aligned Modern Health, just in case it's your first time joining us on a digital doc presentation. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, providing support for the whole body. Our goal is to get to the root cause of why you're feeling what you're feeling, and not just putting a Band-Aid on any set of symptoms or conditions you might be experiencing. We have 18 clinic locations in the Chicagoland area, and we also provide telemedicine support to 8 US states. Our services include chiropractic physical medicine, which is supported by chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. We offer full acupuncture services, including acupuncture and other modalities under the traditional Chinese medicine umbrella, like cupping and moxibustion and herbal medicine. Acupuncture can be really beneficial for physical pain symptoms, but also some intangibles like stress, anxiety, depression, men's and women's health, and of course, hormone balancing, fatigue, sleeplessness, fertility support. So a lot of really great things under the traditional Chinese medicine umbrella. We round out our services with functional medicine and clinical nutrition. And we like to say this is a great way to look internally to better understand why you're feeling what you're feeling externally. We treat a lot of gastrointestinal symptoms and conditions, autoimmune disorders, bloating, constipation, fatigue, migraines, of course, hormone balancing, food sensitivity testing, and we also offer nutritional counseling. We are in network with most major insurance providers and offer free consults for more information. At this time, I would like to introduce our providers that will be speaking with us today, and we will be taking questions at the end of the presentation. First and foremost, I'd like to welcome Dr. Parra.
Hi, thanks for the introduction, Janine. Welcome, everybody. I'm so excited to talk to you a little bit today about what Dr. McGee and I do and the things that we get to sort of treat on a day-to-day basis in our practices. First of all, I started my education journey at U of I in Urbana-Champaign. I got my bachelor's in molecular and cellular biology. I was geared to go more the Western medical route and met some awesome acupuncturists that put me on a path to where I am today. And I'm so forever grateful that I get to practice this wonderful medicine. I then did my master and my doctorate both here in Chicago at Pacific College of Health Sciences. I started out focusing on more mental health type issues in my practice, but over the years I've been drawn and fascinated to more women's health, specifically the treatment of fertility, and how anxiety, depression, and mental health issues sort of influence fertility. And that's what I work on the most. Dr. McGee?
Yeah, hi everyone. I'm Dr. Sarah McGee. I have a background actually in emergency medicine. I worked on the ambulance for about 10 years and then switched to a more alternative route when I saw a lot of diseases I was seeing on the ambulance stemming from more chronic type issues, lifestyle, diet modifications. So I ended up completing undergraduate work in biomedical sciences and then went on to receive my doctorate in chiropractic medicine. I did a significant amount of postgraduate education afterwards in functional medicine. The main areas I focus on now are women's health, gastrointestinal disorders, and autoimmunity. And those are kind of the areas that I like to focus on and help people with their symptoms on.
Thank you.
Sorry, Janine.
I was just going to say thank you both so much for joining us, and go ahead and turn the conversation over to you.
Thank you. So we'll start by telling you a little bit about what traditional Chinese medicine is and how it works. So a lot of people know that acupuncture is great for pain. They tend to view it sort of as a physical medicine, and it certainly does that. But what folks are sort of surprised to learn is that traditional Chinese medicine is a whole health system. I just had a patient yesterday tell me, like, wow, everything that like comes up, any new thing that I come up with, you always have some kind of trick up your sleeve, because that we really look at the body holistically, right? And what does that word holistic even mean? That means that we're looking at the whole system. Whereas Western medicine tends to isolate systems and look at things, you know, just in the gut or just in physical pain. We like to gather all the information that's going on, and sort of develop a whole picture of how the body influences all the different systems that are working together. So because of that, it's very unique and customizable. You know, 10 people can come in with migraines and I'll probably treat them all completely differently. They could be coming from, you know, more their gut, more their stress, more of their hormones balancing, right? So we really want to know sort of what the symptoms are that you experience on a day-to-day basis. And even if you come in for one thing, we're going to talk about everything from top to bottom, just to make sure that we're addressing everything that you've got going on. Even if we're just treating, right, your elbow. Well, maybe there's a sleep issue that's underlying that seems unrelated, but might be related to me. So as Janine mentioned earlier, Chinese medicine consists of a lot more than just acupuncture. Acupuncture is certainly kind of the workhorse and a big tenet of our medicine, but we also practice Chinese herbology to further support what we try to achieve through acupuncture. There's also Chinese nutrition, which is a little bit different than what functional medicine does. It looks more at the energetics of the foods that we eat. There's also Moxibustion, Tuina, and Qigong, which are different exercises and accessory techniques that we sometimes use in clinic to help reinforce what we do with the acupuncture. So how does it work? We're mostly looking at balancing organ systems, right? So through Chinese medicine, we sort of look at symptomology as arising from different imbalances in the system, and how and where those symptoms show up clues me into what organ systems are being affected, and how I can use points on the channels associated with those organs to help resolve those issues. I like to compare it to a stream or sometimes a circuit, right? If you have a dam in the stream, you'll have excess upstream and deficiency downstream. That's not good for either side, right? You don't want too much of something, it causes dysfunction. You also don't want lack of nourishment, that also causes dysfunction. For more of the circuit example, right, you have a break in the circuit, then the lights don't go on, just doesn't work anymore. From more of a biomedical standpoint, we're looking at biochemical and nervous pathways. Acupuncture works on a cellular level to help improve self-regulation and help enact your body's healing mechanisms. That can involve hormones, neurotransmitters, other substances, micronutrients that are carried by the blood, the way that your brain interprets pain signals changes, and there's immune factors involved. So really a lot of different things that we're influencing with acupuncture. And I think one of the most important things is that we're influencing your central nervous system. So you're more likely to be kind of inducing that parasympathetic system when you're using acupuncture. That's the opposite of fight or flight. So that's your rest and digest system. I like to say that acupuncture is kind of like a deep forced meditation. People take a 30-minute nap with needles and feel like they just got a 7-hour night worth of sleep. That's extremely restorative and leaving them feeling really relaxed, and things just work better when you're relaxed and balanced. It also helps to regulate the Hpa axis, which is the hypothalamic, pituitary, and adrenal axis, which has a lot to do with hormones. And Dr. McGee is going to talk a lot more about hormones a little later in our chat, but I'll have her sort of introduce what she does.
Sure, thanks, Dr. Para. So kind of when we look at functional medicine, you know, functional medicine takes a very holistic approach also in viewing the human body, kind of like how Dr. Para said, sometimes symptoms can seem unrelated, but they could be connected in the bigger picture. So we really like to focus on everything going on in the human body. So we're really trying to figure out the root of the problem. So not just covering up the symptoms or treating symptoms, but we're really trying to figure out the underlying reason as to why certain symptoms might be happening. It's a completely customized approach based on each individual patient because everyone is different. Everyone has a different biochemistry. Everyone has different genetics, so no treatment plan ever really looks the same. When it comes to, different testing we do, typically we're looking at pretty comprehensive testing when it comes to blood work or stool testing or saliva testing or urine testing, just because the more data we can collect, the more we can target treat certain areas and support physiological processes in the body that just may not be working as optimally as we want them to. We can't not talk about nutrition. The foundation of functional medicine is always going to be nutrition. What we put in our bodies food-wise is so important. We can't out-supplement ourselves out of a poor diet or out-medicate ourselves out of a poor diet. So we do work with an amazing team of functional medicine nutritionists, and we kind of work hand in hand in crafting an ideal nutrition plan for each individual person based on what they're coming in with symptom-wise or what in their body is not quite optimized. We also, kind of depending on what we're finding, we'll use different nutritional interventions, lifestyle modifications, supplements. When it comes to the supplement world, it's kind of like the wild, wild west. There's a lot out there when it comes to supplements, and it can get overwhelming. So when it comes to really customizing specific supplements that you individually might need, that's when it really comes in handy to have blood work to help guide us, or your individual symptoms, or kind of what clinically might be going on you as an individual to really kind of target the supplements that might be necessary. We also make sure that all the supplements that we do recommend are of the highest quality. They're all physician grade, third-party tested, just to make sure that everyone is getting the highest quality products when it comes to treatment.
So what are some conditions that we treat that are driven by hormone imbalance? So I think I already mentioned that I work a lot with fertility, subfertility, infertility, or even just supporting natural fertility is something that we work on a lot, both in functional medicine and with acupuncture. That's a field I specialize in, so I see a lot of folks trying to conceive in my clinic, and that's speaking to both females, males, and then also trans and non-binary guests, right? So, and even if they're not trying to conceive, we also support them through different changes of sex hormones. And then obviously us women, we have a lot going on in terms of hormones on a monthly basis. So a lot of issues that can be happening around the menstrual cycle, amenorrhea, dysmenorrhea, endometriosis, just periods that are really symptomatic, PCOS, any kind of irregularities. I have a lot of patients who have been on birth control for a long period of time. They're looking to get off of it. They're sort of afraid of the Pandora's box of issues that they're gonna open after being, on birth control and suppressing that natural period for 15, 20 years. So certainly helping to sort of mitigate those side effects and helping people through those processes. Also, at the other spectrum of things, we help a lot with folks going through menopause and all the sort of unpleasant symptoms that come along with that. Also supporting people postpartum, which is huge. I feel like we treat a lot of mothers in trying to get pregnant and helping them get through their pregnancies, and they sort of get wrapped up in the life of having a new baby at home and stop taking care of themselves postpartum. But that's when you need to fill your cup the most. So I really love supporting those women. And then other than sex hormone issues, we're also looking at thyroid issues, which can present as sort of problems with energy, with heat and cold intolerance. Some gut issues can be coming from the thyroid, right? There's a lot of things that fall under that thyroid umbrella that you might kind of be explaining with something else. Oh, I'm just tired. I'm just doing a lot lately. You might not know that there's an underlying thyroid issue. We also work a lot with anxiety and depression, sleep issues, temperature regulation. You could be waking up in the middle of the night drenched in sweat. You could be waking up in the middle of the night extremely anxious. Those are all things that we can treat with acupuncture, herbs. And then Dr. McGee will also tell us a little bit more about how hormone imbalance leads to these issues.
Sure. So kind of when we're looking at hormones altogether, what hormones are we looking at? We have our sex hormones, so our estrogen, testosterone, progesterone. we have our main stress hormone, cortisol, which is capable of causing all sorts of dysfunction in the body. And then we also have our thyroid hormones. And all of these hormones need to be produced at the right levels. They need to be cleared from the body at the right levels. And if there is certain imbalances happening or the ratios start to become a little bit skewed, that's when we can start seeing the problematic symptoms that happen with, painful periods, PCOS, coming off of birth control, kind of all of those different hormonal issues. When it comes to, for example, if you don't have enough thyroid hormones, we end up in a hypothyroid state. If you're a woman with too much testosterone, that can push you down a PCOS pathway. So all of these hormones need to function in a nice little balance. And when the ecosystem becomes unbalanced, whether we're not producing enough of the hormones or we're not metabolizing them correctly, or we're not clearing them correctly, then we start to see these imbalances that lead to then the clinical symptoms that Dr. Perry was talking about. We can't not focus on the main stress hormone cortisol, especially with the past couple of years. There's been a heightened amount of stress in a lot of people's lives, especially when it comes to women nowadays. You're juggling kids, a family, work, so that can be a lot of stress just in that. When it comes to having high cortisol levels, the cortisol is capable of creating blood sugar dysfunctions, sex hormones dysfunction, thyroid type issues. So definitely one of the things that we focus on a lot is just stress management, because even if we are mentally thinking that we're dealing with stress well, it can definitely start to present physically and cause all sorts of dysfunction and clinical symptoms.
So I'll tell you a little bit about how treatment looks with acupuncture. Usually when we see new patients, we sort of discuss their main complaints. And then, like I mentioned, we get an idea of what's going on in the whole system, top to bottom. The body's sort of viewed as a microcosm of what happens naturally in Earth, right? So through talking about your symptoms, I get an idea of what your Chinese medical diagnosis is. Based on that diagnosis, I choose points that correlate to the things that I want to see change and how I want to reestablish homeostasis in the body, right? So in Chinese medicine, a body that is in a natural state of flow, an unimpeded flow, is working correctly. It's in homeostasis and there's no stagnation, there's no issues that are leading to things going wrong. But, we're human and something's always going wrong. So when we have that interruption of free flow, we develop stagnation, right? And how I used that example earlier, sometimes you'll have excess, sometimes you'll have deficiency. There's a lot more complicated kind of diagnoses that go into it, but I feel like those are sort of the basic categories that we start to split things into, right? Are we stagnant? Are we excess? Or are we deficient? So sort of just like Dr. McGee mentioned, how stress and cortisol work. In Chinese medicine, we look at stress as stagnating your emotion, right? You're feeling repressed. Stress can literally make you feel emotionally stuck. And a lot of people will say, oh, I hold my stress in my low back, or I hold my stress in my shoulders. Well, when you're feeling emotionally repressed, right, that is actually putting the brakes on your body's energy flowing freely, right? Which then manifests next as more physical symptoms, right? So pain is stagnation physically in the body. That's why working out feels so good, right? Like movement helps your body keep moving, it helps your brain keep moving, and it kind of relieves those symptoms. So that's sort of what I'm trying to achieve with acupuncture, right? We're going to move the body's energy. We're going to work sometimes directly in the area of pain, sometimes more systemically, or things that pertain to your diagnosis, and hopefully start to reestablish that flow and that kind of unimpeded homeostasis and health. Another example is deficiency, right? Like you can be blood deficient, which for us is often a little bit more immaterial or subclinical. But when it reaches a more advanced point, right, you could look at blood deficiency as anemia, like actually not having enough blood. It could be presenting as like poor nutrient delivery to different parts of your body, right? More like tense, ropey muscles. You could have some dizziness, some weakness. maybe it shows up as a more of a sleep issue, a scanty menstrual cycle, or no menstrual cycle at all, right? Can be showing up as migraines. So I really have to suss out, where the issue is coming from. And people are complex, right? If there was just one issue to treat, we could just do a couple points and send you home on the same day. That'd be fantastic. But oftentimes there's many different issues going on for folks. I like to use that example too with the uterus, right? The uterus is a muscle, and just like you could have muscle tension and lack of circulation anywhere else in the body, when you're constantly in a state of stress, like your uterus is not delivering all the micronutrients that it needs to the uterine lining or to your follicles and your ovaries, right? So if you're focusing on kind of relieving that stress overall, bringing more nutrients to the reproductive system, then you're kind of thinking about how you're influencing not just egg quality, but implantation down the line, right? Which is super important if you're looking to conceive. In the same thread, that's how we balance cycles. That's how we can work kind of pre-fertility, getting you geared up to try to conceive. Or supporting you through the IVF and IUI process. We sort of meet people at any phase of that process, right? Sometimes people are just starting to think about it. Sometimes people have been through a few rounds of IVF and they're looking to optimize their results. And at any point, acupuncture can be super helpful. Like I mentioned earlier, we're also thinking about men when we're looking at fertility, because 50% of fertility issues are actually coming from the male side, right? We tend to put that stress on the women as a society, but it's not just us women that are responsible for making those babies. And then also as far as sex hormone goes, we're also supporting people who aren't trying to conceive. There could be a lot going on with sex hormones. We're also trying to support our patients who are going through transition and how those interventions are going to affect them both emotionally and physically. Taking those injectable hormones can cause a whole slew of side effects that are super unpleasant. And just trying to help your body potentiate that medication and mitigate any negative side effects is going to be really important to help them support through that process.
So then when we're looking at kind of the functional medicine treatment of different hormone imbalances, getting some comprehensive blood work is always helpful, kind of seeing exactly what the hormones are doing at certain times of the month. For example, sex hormones, it's ideal if we look at those on day 3 and 21 of a woman's menstrual cycle to kind of see how the estrogen, the progesterone are changing, if they're rising and falling the way they should. And, when it comes to the hormones, we're really trying to support the proper production of the hormones and then the proper clearance of the hormones. So, for example, the thyroid needs proper amounts of nutrients like iodine, selenium, B vitamins, iron to properly build and then convert the thyroid hormones to their ideal numbers in the body to produce the intended effect on essentially every cell of the body which responds to thyroid hormones. Often I find simple deficiencies in iodine or iron that can really affect how the body is able to build these thyroid hormones. When it comes to then also liver health and gut health, the liver is responsible for the metabolism of a lot of these different hormones. So supporting liver health definitely makes a difference. And then also supporting gut health. They've shown that when they research the microbiome in our large intestine, kind of all the good bacteria and bad bacteria that we have down there, the microbiome health can play a huge role on how hormones are utilized in the body. So focusing on gut health also can make a huge difference when it comes to infertility, painful periods, and different hormone imbalances, thyroid health also. The nice thing about functional medicine, and especially the nutritional component of it, is that we can use it in tandem with pharmaceuticals. We can do different interventions during pregnancy. Everyone on our team has access to databases of researched interactions between supplements or herbal blends and then pharmaceutical medications. So if we're recommending something, we're able to kind of cross-check to make sure it's not going to cause any problems. And especially when it comes to co-managing with acupuncture, that's one of the most amazing things is if I am kind of limited to what I can use supplement wise. There's a lot that one of our acupuncturists can manage without the supplement side of it. And then we can really work to co-treat and co-manage and brainstorm together about different modalities we can use to really achieve the optimal goals for patients. And then lastly, when it comes to, supporting the patient populations going through a transitional stage, kind of like Dr. Para mentioned with the different extra estrogen in the system or extra testosterone in the system, when it comes to a functional medicine approach, we really want to make sure that the certain pathways and the metabolic pathways that are responsible for metabolizing and clearing those hormones, that they're running as smoothly as possible so that there aren't those unintended side effects or adverse effects. And then also when it comes to, supporting fertility and fertility, the transition process, it can be a hugely emotional time, and there's a huge mental component to those types of processes. So that goes back to supporting the main stress hormone in the body, which is the cortisol. So typically when we're co-managing those patient populations, there is a huge focus on also the stress and the mental aspect of going through a process like that.
Yeah, I just wanted to echo what Dr. McGee said. I really love co-managing with functional medicine with any type of hormone kind of issue, right? So I think acupuncture is fantastic at sort of managing that stress response, mitigating any acute symptoms and trying to balance cycles. And then, there is a nutritional aspect from Chinese medicine, but I feel like functional medicine just is so specialized in that area, and that they can really help build an excellent foundation to build upon, making sure that your body has the correct nutrients and that your lifestyle and diet kind of reflect where your body needs to be going. So, each one is great on its own, but together they can't be beat. All right, so that about wraps up what we've had prepared for today. We're going to do some Q&A. So Janine, if you wanted to pop on and help facilitate that.
Yeah, absolutely. Thank you so much to you both for this amazing information. We do have time for some questions, and we do have questions coming through. Please go ahead and type your questions into the Q&A feature or the chat feature. I will be able to see them there, and we will share them with Dr. Para and Dr. McGee. In the meantime, while you type those in, please know that we do have free 15-minute consultations available. If there are any questions that you do not feel comfortable asking in front of a group, you can give us a call directly at 773-692-6700, or you can visit us online at alignedmodernhealth.com. As I mentioned, we are in network with most major insurance providers, and we can offer a benefits check to see what kind of coverage you might have on your plan. I do see a few questions coming in about that. We also do have a question or two here that I can answer to give Dr. Para and Dr. McGee just a bit of a breather. If anybody did join late, the recording will be sent to all who registered. So whether or not you were able to join on time or late or not at all, as long as you registered, we will be emailing the recording out to you. We also have a question here about our locations. Our physical clinic locations are in the Chicagoland area, in the city and in the suburbs. We do have telemedicine available in Illinois, Colorado, Florida, Minnesota, Ohio, Washington, Arkansas, and Missouri at this time. Let me go ahead and now address some questions that I cannot answer. We will start with a question about menopause. Dr. McGee, if you want to answer first, and then Dr. Para, if you'd like to address as well. If a person is experiencing persistent hot flashes and disruptive night sweats, is functional medicine and/or acupuncture appropriate?
Sure. So I do see a lot of menopausal patients. When it comes to that transition, every woman experiences it differently. So kind of depending on what symptoms you're particularly having, there are certain herbal formulas, supplements that will ease that transition. And then also other things like supporting nutrient health, gut health can also ease those symptoms. It also kind of depends on exactly what you're coming in with, because like I said, everyone kind of goes through menopause a little bit differently. But definitely when it comes to optimizing the nutritional side of it, working to decrease any inflammation in the mix, and then supporting with some targeted supplements would kind of be what a functional medicine approach to it would look like.
Yeah, I'd agree too. It's something that I treat pretty often. I think that those symptoms can be pretty stubborn. They're tough to get rid of, but certainly I've had a lot of patients have quite a bit of relief, especially with the night sweats and hot flashes.
Thank you so much. Going back to the fertility conversation for a moment, is there a quote unquote best type of acupuncture regarding the method or the frequency, or is each treatment plan customized to the individual?
Yeah, so I usually give my opinion on kind of frequency and treatment plan after we've been able to meet, after I've been sort of better able to assist or assess your individual condition. I will say that with anything cycle or fertility related, I do want to see you through several menstrual cycles, right? It's just because as those things change, you know, you kind of don't get that information until that period comes around, right? To see what you're really influencing. As far as what the best type of acupuncture is, I'd say that you certainly want to see somebody who's had some degree of training in specifically fertility. Generally, acupuncturists practice general medicine. Usually everybody will be able to treat everything. But at Align Modern Health, all of our acupuncturists are specifically trained on more additional training on fertility. And then there's a few key providers that sort of specialize in it, and we treat simply more of it than other providers do. So my preference would be that you would see either me or a couple of other of our providers who really treat a lot of fertility and are well versed in it. And I want to also say that, you know, unexplained might be unexplained from the Western viewpoint, and it might be unexplained from my viewpoint too, but oftentimes because we look at things a little bit differently, we'll be able to pick up on nuances and changes that maybe your Western medical doctor isn't paying attention to. So there could be something there that they simply didn't see and that we can help kind of correct.
Thank you. We have a question here about some symptoms from hormone imbalance, and specifically in hair regrowth after hair loss. Would either of you like to address that, or perhaps both of you?
Sure. So, you know, when it comes to different underlying factors to hair loss, if it is related to hormones or not, the hair loss can be tricky. That can be, I've seen that related to everything from nutrient deficiencies to gut imbalances, to the hormonal imbalances. So really when it comes to a general symptom like the hair loss, we'll kind of have to dig into a couple different areas for that. Definitely the hormones is something that we do want to check on. That could be an underlying, driving factor, but hair loss there can definitely be several different things impacting the hair regrowth or hair loss, whether it's shedding versus, the hair breaking. Dr. Hpa.
Yeah, I think there is something that can be done. I think that certainly from a functional medicine perspective, building that foundation, like I've said before, as far as acupuncture goes, there's sort of herbs and topical solutions like acupuncture modalities that you can use to help sort of bring back hair growth. I think it's successful where there's thinning. I think it's successful where there's sort of patchy or spotty alopecia or hair loss. Where I have found that it doesn't work much if it's like full-blown male pattern baldness or something more genetic. What I've talked to colleagues about is that if there's still a hair shaft and a hair follicle, you can sort of increase its productivity. Where there is a follicle that has completely stopped producing hair, as there is, a full sort of baldness that's been around for several years, there's really not much you can do. So it kind of depends on where you are on the spectrum. There's a lot we can do, but also, sometimes can't do miracles, right?
Absolutely. Thank you both. We have a few questions coming through regarding the supplements and potentially maybe even the herbal medications that we've mentioned here today. Folks are wondering if there are any specific brands that they can look for, or if this is what we're talking about may need to be prescribed by a medical provider to get that high grade quality. Dr. McGee?
Yeah, so we use an online dispensary system that essentially houses literally thousands of different supplements, numerous brands across the board. Some of the supplements I have seen on places like Amazon. I would be very careful about the kind of the Amazon market of supplements, as there's sometimes quality issues or temperature control issues when it comes to where the products are being stored at. Some of the brands, just to kind of throw a couple out there, Apex is a brand that I use a lot that is usually prescription based. A couple of their formulas are, so that'd be something that we would have to kind of prescribe. Pure encapsulations, Metagenics, there's countless different brands that I kind of pull from. The other nice thing is that because we have access just to so many, when it comes to the form of the supplement that we're using, whether it's a pill or a chewable or a capsule or a liquid, there's definitely a lot to explore if it comes to if you have trouble taking supplements or you feel better taking certain forms of supplements. And I know on the Chinese medicine side of things, as Dr. Parra can say, they have their own very complex way. So what does that look like?
Yeah, herbal formulas are pretty complex. That's definitely something that you can't really self-prescribe. You have to have a pretty deep understanding of both Chinese medical diagnosis and prescription, right? So those are custom-based formulas. They can have anywhere from 2 to 10 different herbs in them. There's some kind of ready preset formulas that we use in the clinic, and then sometimes custom formulations that we're ordering from a pharmacy. So definitely, as far as Chinese herbal medicine goes, you'd have to kind of use it as a supplement to your whole treatment plan.
Thank you both so much. We have a question. You mentioned in the presentation that obviously women and men both can contribute towards infertility or subfertility. Is there a way to identify perhaps who in the couple is experiencing the fertility issues, or do you more so treat after that is already known?
I think it can go either way. It sort of depends on where you're at in your fertility journey, right? So some folks come in and they've already had some degree of testing done. Maybe they've already seen a reproductive endocrinologist to get an idea of, hormones and sperm analysis and all sorts of ultrasounds that they can do to sort of look for any obvious issues. And in those cases, they might know that it's sort of coming from one side or the other. Certainly, I love seeing couples together, whether it's on one side or the other, because it's stressful for both parties, right? And even if there isn't a quote unquote issue on one side versus the other, it's just helpful for circulation to help manage the stress around things and to help improve kind of what everybody's going to be contributing. But that's something certainly we can try to talk about if somebody's not sure yet where the issue is coming from.
Thank you both so much. We do have a number of questions still here that are a little bit outside of the hormone balancing conversation. If you are asking about symptoms or conditions outside of this conversation, we highly recommend scheduling that free consult or visiting alignedmodernhealth.com for more information. We certainly don't want you to feel ignored. We just are keeping the conversation topical to the topic today. We have time for one more question. Do you have any ideas or typical experiences that people can expect if they're going off birth control from a hormone imbalance standpoint?
Yeah, so this is definitely a big one. When you've been on birth control for a while and then you go off of it, some of the things that I see commonly is issues with acne, problems regaining a normal menstrual cycle. Those are kind of the main ones, is the skin type conditions, and then just trying to maintain that cycle once you get it back. We're really kind of looking at what the hormones are doing at that point. There are certain supplements and herbal blends that are meant to nourish the proper production and communication between the brain and the ovaries again, to try to reestablish that natural cycle. What I've seen is everyone's experience is kind of different, and there definitely are some proactive things we can do to make sure the transition goes as smoothly as possible. But then sometimes things will just pop up as we go, and that's why it will often take a couple months to really get everything fully situated, because unfortunately we only have one cycle per month. So we kind of, it's a timing thing where we kind of have to give it a couple months and be patient to see how things are going, and then provide support to the areas that need supporting.
Yeah, from my perspective, I see a lot of folks who maybe originally wanted birth control to help mitigate some terrible symptoms that they were having around their cycle. And unfortunately, birth control just kind of masks those symptoms. And often, when you come off the birth control, you can either not regain a cycle or just go back to that terrible cycle you were having before. And so what I like to do is sort of start the acupuncture before you're sort of ready to stop the birth control, just to kind of start regulating things already, and then help support you through that transition, just to make it a little bit smoother. And again, reestablishing a regular, relatively symptom-free cycle on the other end, kind of reteaching your body how to use those hormones and how to work, since it didn't have to do that job for a few years.
Thank you both so much for that insight. We do have a number of really great questions left, but unfortunately we have come up to time for today's presentation. If your question has gone unanswered, please know that it is not intentionally being ignored. If you have questions about specific conditions like PCOS or menopause, we absolutely can help and would love to get you into one of those free consults, so those do get answered. If you have questions about what specifically supplements or herbal formulas would be appropriate for you, that is absolutely a great individual conversation as well. Dr. Hpa, Dr. McGee, thank you so much for joining us today. We really appreciate it. This is clearly a topic that has a lot of engagement and a lot of interest, and so we really appreciate your time. Thank you to all of those that have joined us today. And again, you will get a copy of this recording if you did register for the event. So we really appreciate your time, and we hope that you have a great rest of your day. Cheers.